So Rick Scott, man whose company paid $1.5 billion in Medicare fines or Medicare fraud fines, has overseen the cuts of Florida's human service agencies, health and human services agencies, up to, I don't know, millions and millions of dollars. They specifically cut $4 million from Florida's infectious disease control budget. And the hospital that specifically covered TB. Why is this an issue? Because in April, the CDC, or I should say an investigator at the CDC, warned Florida health officials that a TB outbreak taking place in Jacksonville, Florida, was one of the worst they'd seen in 20 years. The investigator said, you need to deal with this epidemic immediately. You need to mitigate this in some fashion. The Palm Beach Post says, had they seen the letter, decision makers would have learned that 3,000 people in the past 2 years may have had close contact with contagious people at Jacksonville's homeless shelter, an outpatient mental health clinic, and area jails, yet only 253 people had been found and evaluated for TB infection, meaning Florida's outbreak was and is far from contained. The public was not to learn anything until early June, even though the same strain was appearing in other parts of the state, including Miami, and that is because of budget cuts. Maybe what Rick Scott should do is just get all those scientists, get all those doctors, those clinicians that deal with Florida's infectious disease control agencies and just pay them, I don't know, minimum wage. Unbelievable. And of course, those aren't real jobs anyways, right? The government can't make jobs. Why don't we just farm this out to some private corporation that I am sure would put people's health above making a profit? Their tagline could be, we're the first company ever to do that.